Welcome back to the Now Morning Show. This is your Body and You segment. I'm Kimberly D'Souza. Now, April is commemorated as Women's Eye Health and Safety Month. One of the interesting things about that is that 2 out of every 3 people living with blindness or eye issues are actually women. So to talk to me a little bit more about how we can protect our eyes, we have Ms. Priyanka Prasad, who is the Surgical Services Manager at the Trinidad Eye Hospital. Ms. Prasad, good morning, and thank you so much for joining us on Now.
Good morning, and thank you for having me.
Now, Ms. Prasad, why is it important for women to have these, eye examinations so early and so regularly?
Generally, women are at a higher risk for visual impairment and blindness, and that's predominantly because we have so many hormonal changes, especially during pregnancy or menopause, and that's a discussion that the doctors would have and further expand on with the patients. But because of this, it's important to have routine, comprehensive eye examinations so that we can detect any changes that might be occurring within the eye. And if any treatment is required because of these changes, then we can plan for that to prevent any visual impairment or blindness in the near or distant future.
Now, Ms. Prasad, what are some of the common vision problems that women may experience?
Women experience more commonly refractive errors. So these are things like nearsightedness or farsightedness, which can be corrected with either contact lenses or glasses. So it's worth a trip to your optometrist. Twice as more women than men would experience dry eye symptoms. Also, studies have shown that approximately 60% of persons with age-related macular degeneration are women, and similarly with other conditions like glaucoma or even cataracts.
Now, Ms. Prasad, when women are pregnant, their body, it goes through so many changes. Do we have, problems with the eye when women are pregnant? Is this a particular issue?
It is. Women that are pregnant would have several problems with the eyes, especially if they have underlying conditions such as hypertension or even diabetes. And diabetes is especially important because pregnancy can cause progression of the diabetic eye disease, which could lead to visual impairment or even blindness because they can have things like hemorrhages in the eye or even retinal detachments. And if left untreated, can result in blindness. So it's important for women who are pregnant to have routine visits with their eye specialists and also inform them that you are pregnant so that if any plan for treatment has to be made, it can be tailored to suit the patient so as not to harm the baby. And sometimes a lot of women that are pregnant would have to have co-management for their treatment between their general doctors.
Now, Ms. Prasad, as much as you're advocating for women to get, treated or to get tested regularly just for any, issues with their eyes, has there been a trend of women not being able to access these services?
My view is that the access is there, but there are several challenges associated with that. For instance, over the last couple of years, we've been facing a pandemic, which resulted in the public health sector having issues with offering the healthcare services, or more specifically, eye care services. And so patients coming out of the public healthcare system were forced to now turn to a private healthcare system, which means that you have to pay for these services. And it poses some financial difficulties for patients coming out of the public hospital. And so the patients would then decide to wait until their appointments get rescheduled, and waiting, their sight continues to deteriorate. And so it reaches a stage where it becomes too late to save that sight or even preserve it. Another issue that we see in our clinic is that a lot of women come in mothers, and mothers, they tend to put themselves last, prioritizing their family. So these mothers would then want their children to get their glasses, they want their husbands to get their surgeries or treatment done, they want to save money for other things in their lives, their family lives. And so they continue to struggle on with their own deteriorating vision, again, until it reaches a point where it may become too late to save their sight.
So then how can we improve the situation?
So just to tie this in, an example of what we saw in clinic, we had two patients, a mother and a son, both diabetics, both needing surgery to both eyes. Of course, the mother prioritized her son because he had severe advanced diabetic eye disease with very poor vision to both eyes and needed a lot of treatment. So she used her savings to get her son treated. Unfortunately, her son passed away and she was left alone. She came back to clinic to have a chat with us. She said, I spent my savings on my son. He's no longer here. And now I'm left alone and I can't seem to do anything for myself. And we hear these stories so often in clinics. And when you hear that story, you really don't know how to respond. You kind of cry inside a little bit and wonder, how can you help these patients? Some of the ways that we try to help patients within CVRS and Trinidad Eye Hospital, we've employed our subsidized pricing system, which is essentially a discount on almost all of our clinical services, and 100% of our surgical services have been subsidized so that patients can get their treatment done. So she was able to benefit from the subsidized pricing on our surgeries to have her treatment done. So she's now independent, she can see, and she's happy. But other things that we have employed within the organization is outreach programs, education programs, diabetic eye screening, which is completely free, just to bring awareness and education to the general public about eye health and eye care.
I appreciate that there was a silver lining to that story, because I think it was so sad that she lost her son and she was almost at risk of losing her sight. So I appreciate that there was a silver lining in that story. But Ms. Prasad as well, so when you have vision problems, for example, if you are, going blind, is there any way to, to reverse that effect? Or is it that you will just continue to lose your vision as time progresses?
I think it depends on the condition that is the underlying condition for the visual impairment. Cataracts, for instance, is something that can be treated with a simple surgery. I say simple, but it's surgery nonetheless. However, other conditions like macular degeneration or glaucoma, it's a little bit more difficult. Sight from glaucoma that is lost is sight that usually cannot be regained.
And as a suggestion, or even, some of the right things that we should do, how often should women get their eyesight checked or tested?
A yearly eye exam is good, a comprehensive dilated eye exam. So you come into your eye doctors, you put drops in, and we get to examine the front and the back of the eye to understand if any changes are occurring there. And if changes are occurring, then we have, we detected it early, so we can plan for treatment if needed to prevent any further vision loss.
Now, I know that there are specific vision impairment for women, but for our men viewers who, might be looking on, what sort of risk are they prone to for these eye diseases?
It's similar for men and women. It's just a little bit more predominant in the women because of hormonal changes. But again, blurry vision is something that a lot of people struggle with, and it could be something as simple as a refractive error that can be corrected with glasses, or it can be something that may need surgical intervention, for example, early onset of cataracts, or even with something like glaucoma, which definitely needs to be treated. So any changes in your vision, it's important to reach out to your eye care specialist, your ophthalmologist, or even your optometrist for treatment.
Now, Ms. Prasad, apart from the eye exam, are there any preventative measures we can take to ensure that, we kind of maintain a healthy eyesight, I would say, throughout our lives?
Well, the regular diet changes. So you want to ensure you have fruits and vegetables, your omega-3 fatty acids, good hygiene. So lid hygiene is a important part of your eye care regime. People that wear makeup as well, you want to make sure you get that makeup off. Do hot compresses. It really helps to allow lubrication on the eye. And generally, that's it. You just want to continue with your routine eye examinations as well.
Now, Ms. Prasad, I've often heard the argument where some people say, I have good vision, but I just need a pair of reading glasses. So is the use of the reading glasses over time, will that advance, vision impairment? And additionally, how important it is for you to go and get tested and to get the right prescription for your eyes?
So a lot of people have changes at the front of the eye with regards to refractive errors. So that is nearsightedness or farsightedness, or we may have astigmatism, which causes a little blurry vision, and you may need to have glasses for that. However, as you get older, your eyesight tends to need some help, and so your lens changes a bit, and you need to have some reading glasses to help to focus. It does not cause any progression with visual impairment. It just helps us to focus.
And again, how important is it for us to get the right prescription when we go to get these eye exams?
Oh, it's very important to have your right prescription, because if you have an incorrect prescription, then you will continue to see blurry.
All right, Ms. Prasad, and anybody who's looking, any advice that you can give them before we close?
Yeah, so prevention is better than cure. Sounds cliched, but it is. So early detection is key. I would say education and awareness is also key. So we empower individuals to become better advocates for eye care, so that we continue to encourage everybody to have routine examinations with their ophthalmologist or their optometrist or both, because eyesight is something that is so precious and we take it for granted because we have it. But it's definitely worth the effort to continue to maintain it. So definitely get checked.
Ms. Prasad, thank you so much for joining us on Now. Have a great day.
Thank you.
And that was Ms. Priyanka Prasad, who is the Surgical Services Manager of the Trinidad Eye Hospital. You're on the Now Morning Show. We're going to take a break and be right back. You know what to do. Stay with us.